Hello, guys. So, when it comes to travel nursing, travel respiratory therapist, so as a quick overview in today's video, I want to give you, you have a few factors to consider. But first, I want to remind you that this is not legal or financial advice. This is not medical advice. This is just me talking and sharing information about travel nursing, travel respiratory therapist. This is just for educational and entertainment purposes only. So going back to a few factors that you must consider when you're thinking about travel as a nurse or respiratory therapist, or if you have been traveling in the past few years as a traveler. So what I've noticed in the past couple of years, there has been a higher demand for respiratory therapists, for nurses. So a lot of agencies out there throwing out a lot of contracts. So a lot of people are asking me, what should I do? Should I start traveling? And if I what does it entail? So let me tell you a little bit about travel as a respiratory therapist and traveling as a nurse. So we have a few things in terms of location. So the first thing you must consider it's about the location. What I mean by that, so do you want to do local travel or out of state travel? So when you think about it, so there are some caveat when it comes to that. So as if you travel locally, sometimes you miss on the stipend, and that's something we can elaborate a little bit when we talk about contract negotiation. But you depends, and they have some rules, some guidelines that you must follow by cities, states, and everything like that. So is it okay for me to do local versus out of state? So sometimes we notice that out of state contracts, you have more benefits if you take out of state versus local. And then it depends on who you ask. Sometimes when you look at numbers for local and numbers for out of state in terms of benefits, you have to ask yourself, does it make sense? And when it comes to that, and a lot of people prefer to do local assignments because, not first of all, they're home. They're not leaving the family. They are not paying for another place to stay. They're not paying for hotels. They are not spending any more money in food. So it makes sense to do local assignments. So, and versus out of state. So sometimes the stipend, the benefits are far greater than for local assignments. So you have to ask yourself, can I try? Can I go out of state? And then, or does it make sense to go out of state? Do I like it? Do I like the numbers? So that's something you ask yourself. So where local assignments can be good for one person, it may not be of advantage for others. So you just have to ask yourself, and if you can compare both and you see what kind of options you have, that can help you greatly. And second, it's a family matter. So that's one of the factors that I have been asking by different nurses and different respiratory therapists. They ask me, how did you do with yourself? Do you have family? And if so, how do you manage family and travel? So first of all, of course, when we talk about traveling, we see going away. Okay, you're gonna leave your family behind, and you're gonna be in a city or in a state and for weeks. If you take a short contract as long as 4 weeks or 8 weeks or 13 weeks, even 16 or 26 weeks. So you're going to be away for a while. Although there's a possibility for you to come back home, it depends on your schedule, and you may be able to travel back home or do back and forth. So that's something, that's a factor. And other thing people do, they travel with family. And for instance, I remember one of the contracts I had in a particular state, there were two families there. They travel with their children, they travel with their spouses, so they were able to make it work that way. So that is something to consider based on your needs, based on what you discuss with your family. And but again, it can be done. And I've seen where you have both husband and wife, both partners are being in the same field, so they travel together. So of course they can save money in the long run. They can save money that way too. So if that's something, sometimes it works for some couples, it doesn't work for others. And thirdly, so one thing to consider if you're thinking about traveling is what it's called finding the job. So you know, now you if you go to social media, you notice there are a lot of positions being posted where before it was just a few, because it has to do with so many agencies being created. So now we have what it's called, when we're looking for positions, looking at the top agencies versus those who just started. And that's one thing you have to do your due diligence. Okay, when you're trying to find a position, a few ways to find a good travel assignment is, the first one is social media. Okay, Facebook, Instagram, what have you. You can see they post some positions out there, and they tell you how much they're paying. They disclose everything, and then they put the recruiter's information, and you contact them, and they usually send you the pay package, including all benefits and the word of mouth. And you can sometimes, if you know any fellow nurses, and of course I'm sure everybody knows somebody, so if you know someone who's already traveling, okay, so sometimes they can refer you to their recruiter, and that way you get straight to a recruiter, and you tell them what you want. They may not have something where your friend is at, or where you want to go, but sometimes they tell you what options they have. That's one way to also do networking and get some job information. So, and other ways to do it is sometimes you go online. You go to you just Google travel agencies out there, and then you see what they have to offer. And we have some top ones. The moment you Google that, they will pop up, and you can see what they have to offer. And finally, what I want to cover for you today is contract negotiation. So now that you have decided to travel, you put it into thought, and then now you made the decision to start traveling. And what you're gonna do, you talk to your family. It is feasible. It is doable. You're gonna get started. You find a position. You're talking to a recruiter. So what they're gonna send to you is a contract offer. Okay. So I know I made that mistake my very first assignment. I just saw the numbers. I just accepted the contract. I didn't even read the terms and condition on the contract. And needless to say, any contract that you're signing, you must read the terms and conditions, and make sure you go over everything. If there's something you don't understand, that way you can ask before you sign it. Okay, so you so what you want to do is you want to make sure you negotiate. Okay, it's not a lot of people are very scared of doing so. So they said they're gonna give you X dollar amount, and plus other benefits, including stipend, where they pay for housing. Sometimes housing is provided in addition to what you're gonna be making, and sometimes they pay you a gross amount of money, and then where you're gonna find your own housing. So you have to look at the contract to see if housing is provided versus you looking for housing. So, and sometimes it's okay. Sometimes you end up saving more money when you find your own place. Okay, it depends. Some contracts that it comes with it. Okay, if you're doing especially crisis or state contracts, they do provide. Some of them do provide housing, so it's already built in. Okay, but you need to ask yourself, okay, do I want housing, or do I want to find a place by myself? Okay, and I know Furnish Finder, Airbnb out there. Sometimes we find good deals versus where they find a place for us. They may give you a place that you don't like, and when you accept housing from that particular agency. But that's one way. And second way to negotiate a contract is to look at it, and then if they say they're gonna offer you X amount of money, you can ask for more. Okay, they can say yes, they can say no. You can negotiate your hourly rate. You can negotiate your stipend. You can negotiate a lot of things. So it's not just because they said you're gonna get this and then you agree, you just take it. You're so excited because especially if it's your first time, you notice what you're gonna be making, all the benefits and everything included, and you're so excited. And of course, I'll tell you, based on experience, no one will say anything to you. They will just have you take the contract, and then sometimes you realize, wow, I didn't even want to do 8-week contract or 13-week contract, but you ended up signing a contract for 13 weeks. You have to pay attention. I remember one time I spoke with a recruiter, and she sent me my contract. The contract was for 2 weeks, and then when I was reviewing going over the contract, it says 4 weeks. So you see, I could have signed a contract for 4 weeks, and in the middle of and then when I think I'm doing only 2 weeks, and then now it's 4 weeks. So it would have been a breach of contract at the end of my 2 weeks. So I have to check with the recruiter, and then she was able to fix that. By the same token, I have another contract that I received, and they told me I was gonna make X dollar amount for per hour, and then when I look at the contract, it was almost $20 less. And of course, because I had experience and I reviewed the contract that way, and because I negotiated with them, they give me what was posted, the original amount that was posted online versus what I asked, what we agreed on. And even if after the fact that I negotiated the contract with the agency, and they still put what was originally posted. So I pointed that out, and they were able to fix it before I signed the contract. This is just a quick overview about travel nursing today. I'm giving you, again, this is not financial or legal advice. This is just educational and purpose and entertainment purposes only. This is what it's for. So I hope you learned something today. If you've been thinking about travel nursing, and please consider these factors about your location, such as local assignments versus out-of-state assignment. Think about the family that you have. Sometimes I've heard before they said traveling as a nurse or respiratory therapist can have an impact on your family, and that is true. So make sure you see what's best for your family before you make that decision. And then finding a job is it can be as easy as 1, 2, 3. Just go to social media. You just type travel nursing in whatever state you want to go to, and sometimes you can see a lot of job position being populated. And finally, I just want to remind you that you have to talk to your recruiter about your contract. And of course, when they send you offer, they want you to sign it right away. Okay, so make sure you take your time and tell them this is what you want versus what they want you to take. So there's no problem doing so. So I hope you learned something today, and it was a pleasure talking to you. And welcome again to this channel. And if that's something you are interested in, I'm putting videos out every week, so talking about sharing information about different topics related to healthcare. So it was great to see you. So remember, you were created to do great works. So until then, hasta la vista.